Sirkal ma pacho ka dhi duoko piny nengo mar thiedho tuo mar sukari kod 50% kaka achiel kuom yore ma kedo gi medruok mar kwan jogo ma nigi tuono e pacho ka. Kaluwore kod jagoro mongirore migawo mar thieth Dr. Uma Oluga, nengo mamalo mar thiedho tuo sukari en achiedh nade maduong' mokalo ne oganda, kowacho ni migawo mar thieth tudore kod kembe maloso gige thiedho tuo mar sukari kod yedhe mondo giduok piny nengo mar thieth. Oluga bende omedo ni piny Kenya nigi jotuo sukari 800,000 ka jotuo 54% pok opim, gino manomiyo idwa duok piny nengo mar thieth nimar onyalo konyo ting'o malo kwan jogo mipimo ne tuono.
With diabetes, you will recall that around 54% worldwide, including Kenya, is undiagnosed. So if you have 800,000 Kenyans, we are likely to have around 2 million Kenyans somehow either pre-diabetic or living with diabetes. We are now revamping the policies that are there. We have the NCD strategic plan for the Ministry of Health, under which diabetes comes, and we are very keen to work on what we call access programs, and we are working on access programs across the board, but 4 things that are important for us. One is, among the non-communicable disease, diabetes is key because of the cost of the medications. We want to reduce the cost of medications by around 50%, and we are working on an access program where the Ministry of Health will take lead in engaging with manufacturers of diabetic products and diabetic medicines, so that then we can make this across the private and the public sector a reduction in the cost.
We have community health promoters, and we are training them in terms of educating them with regards to non-communicable diseases. So they go out of their way to screen and then appropriately refer to the health facilities. Our mandate at Kenya Diabetes Study Group is to train these healthcare practitioners. Now, if we can be able to ensure the Kenyan is actually screened and diagnosed at the right time and then referred timely, we can reduce this economic